While having an oversupply might sound like a fantastic problem to have, it can cause some challenges with breastfeeding and chest feeding. The nursing parent might find that they have to deal with plugged ducts, which are really uncomfortable. And the nursing baby might have some excessive gas or abdominal discomfort, or even green or mucousy stools due to having too much formilk. So when trying to temper down a milk supply, my favorite recommendation is something called block feeding, which means that you essentially feed from one breast for like 2 to 4 hours, and then after that time has passed, then it's the other side's turn. And usually doing this for a couple weeks tends to temper down milk supply, so you can go back to feeding from both breasts per feeding. Other parents with oversupply find that sometimes drinking a cup or two of sage and mint tea can be helpful for tempering down a supply. So if you have an oversupply and you and your baby are just fine, no need to try these recommendations. But if you're struggling, hopefully these will help.